Hey guys, welcome to the education portal of Global Solidarity for Health is Wealth with Dr. Rev Bukie Adams. Today we focus on Graves disease and Hashimoto's. Hey, have your hand been shaking lately? Or are you just getting tired, stressed, and agitated or nervous? Or are you just having faster heartbeat? You may have a thyroid condition called Graves disease. Because we are stressed, so we rage attack. And this attack comes about because stress is associated with these autoimmune disorder in our bodies. An autoimmune disorder derives from untreated or chronic infections and injuries we find in our bodies. With such conflict, our body makes a huge mistake with its normal body cells or part of the cells as pathogens and attack the immune system and destroy the thyroid. Graves disease and Hashimoto are both autoimmune disorder that occurs when the immune system attacks the thyroid. Now, let's look at the thyroid gland, its mechanism, and how it really works. The trachea is an endocrine gland that is located at the base of the neck, gently wrapped around the trachea that is used as a breathing tube. It is also shaped as a butterfly and just located below the cartilage, as you can see in this slide. Now, let's understand the thyroid system, how it really works. The thyroid produces two major hormones. They are triiodothyronine T3 and thyroxine T4. 3 and 4 represents the number of iodine atoms in each of these hormones. Thyroid is controlled by the anterior pituitary that stimulates the thyroid to secrete thyroid-stimulating hormones, TSH. In turn, TSH is induced by the hypothalamus to secrete TRH, thyroid-releasing hormones. These hormones' primary role is to regulate metabolism. An increment in this level of hormones causes a negative feedback in our body. Now let's understand Graves' disease and hyperthyroidism. Graves' disease is the most common cause of hypothyroidism or overactive thyroid in the United States, and it's 7 times more likely to affect women. Now, as you can see in the diagram, in Graves, the body hyperactive immune system produces antibody that attaches to the TSH receptors on the thyroid gland. This is actually happening because TSH is on the run for mass production of T3 and T4 hormones that affects the negative feedback system in our body. And for this, the thyroid continues to make and release more hormones. Now that the antibody is consistently triggering the thyroid cells to produce more hormones, our body responds by increasing the size of the thyroid, causing a thyroid symptom called goiter. Now let's talk about exophthalmos. Exophthalmos is another physical symptom of Graves' disease. It's referred to as the protrusion of the eye. Now let's look at the two main causes of exophthalmos symptom in Graves' disease. It prolongs fight or flight response by widening of the eyes by a retraction of the upper eyelid due to the overactive immune system. The other is it affects the ocular muscles of the eye and become inflamed, pushing the eyes further. With this being said, the metabolic rate that is at rest causes weight loss despite good appetite, irregular heart rate, arrhythmia, tachycardia, heat intolerance, amongst others. So precisely right there, let's understand Graves' disease and diagnosis. Diagnosis of Graves' disease is performed through a blood test that relies on highly circulating levels of T3 and T4 and low levels of TSH. Also, iodine uptake test is used for confirmation. Let's focus on the treatment of Graves' disease. Symptoms of Graves' disease are released through beta blocker, which dulls the activity of the sympathetic nervous system. Methimazole, which is an anti-thyroid medication that is used to prevent thyroid from making more hormones. In severe cases, surgery is recommended to remove hyperactive cells from the thyroid gland. Alright, now let's look at Hashimoto's thyroiditis and hypothyroidism. The most common cause of hypothyroidism or underactive thyroid is Hashimoto's thyroiditis. With Hashimoto's thyroiditis, our body immune system creates antibodies that attack and destroy the thyroid. Henceforth, the thyroid gland cells die from the antibodies attack from the immune system. You should also understand how logical it is that Hashimoto causes a decrease in the size of the thyroid gland, whilst with Graves' disease, water is the earliest symptoms of Hashimoto thyroiditis. That being said, let's look at few symptoms of hypothyroidism. Amongst others, we have psychological symptoms like poor memory and concentration. Also, we have the classic symptoms of hypothyroidism, which is myxedema or skin swelling. Others could be weight gain despite good appetite, fatigue, cold intolerance, slow heart rate, amongst others. For laboratory testing and diagnosis, usually shows low levels of circulating T3 and with high concentration of both thyroid antibodies and TSH. For biopsy, it shows thyroid cells in a large presence of lymphocytes. Treatment of Hashimoto's thyroiditis is a lifelong treatment that consists of T4 replacement through a medication like levothyroxine, which is a thyroxine hormone medication. Now, in a succinct summary, let's compare and contrast these two medical conditions. Earlier, we said that autoimmune disorders come about because of chronic injuries or illnesses in our body. And also, our body mistakes its own cells as pathogens or even part of the cells and sets the immune system to launch attack and destroys the cells. Graves' disease and Hashimoto's thyroiditis are both autoimmune disorders, wherein the immune system influences the action of the thyroid gland in both conditions. Graves' disease is a type of hyperthyroidism. In other words, overactive thyroid. It happens because antibodies stimulate the TSH receptor in the thyroid cells. In Hashimoto's thyroiditis, it's a type of hypothyroidism, which means underactive thyroid. And this happens because antibodies block the TSH receptors and destroy the thyroid tissue. With both diseases, the most common symptom is the enlargement of the thyroid gland. In Graves, GWATA is caused by overstimulating the thyroid cells, whilst in Hashimoto, GWATA is caused by an inflammatory response. In Graves, there is protrusion of the eye. In Hashimoto, there isn't. In Graves' disease, there is high metabolic rate, tachycardia, weight loss despite good appetite, heat intolerance, amongst others. But in Hashimoto's, there is low metabolic rate, bradycardia, weight gain despite poor appetite, cold intolerance, amongst others. In addition, laboratory testing for Graves' disease shows high circulating level of T3 and T4 with low level of TSH. Unlike Hashimoto's disease, laboratory testing shows low level of circulating levels of T3 and T4 with high levels of TSH. As thyroid hormone blockers is to Graves, T4 replacements is to Hashimoto's. Well, this is how we come to an end of our lectures, and this is Global Solidarity for Health is Wealth Education Porter. Thanks for watching with Dr. Ralph Bukie Adams. And one more thing, please don't forget to subscribe, share, and like. Hit the notification button down below. Leave your comments in the comment section telling us the next topic you would like us to cover. Moreover, you can reach us by sending us email and following our social media accounts on Facebook and Instagram. You would also like to join me on my personal account? You can follow me on Facebook and Instagram on the right corner of this screen. Thank you and have a good time. Till then, shalom. I'm out.